Hi, my name is Caitlin Fraguglia, and my health behavior change I chose was to eat less unhealthy and fast foods or to even cut it out completely. This includes things like greasy, high fat, and high sodium foods. When eating unhealthy fast foods on a daily basis or very frequently, you are putting yourself at risk of developing negative health problems. According to the Center for Science and the Public Interest, they say that unhealthy eating and physical inactivity are the leading causes of death in the U.S., leading to around 678,000 deaths a year, all due to nutrition and obesity-related diseases, which include heart disease, cancer, and type 2 diabetes. In the last 30 years, obesity in adults has doubled, tripled in children, and quadrupled in adolescents. The CDC states that 1 in 4 deaths in the United States is caused by heart disease, affecting around 610 Americans annually. Although those were more so long-term effects of consuming unhealthy and fast food, there are short-term effects that impact a lot of us, and I myself have noticed. Being a college student, sometimes it is hard for us to find the time to meal prep, go off campus for a healthy meal, or we even don't have enough money to spend on more healthier choices. Poor nutrition can affect our daily health. According to SA Health, poor nutrition can lead to stress, fatigue, and depression. I was starting to realize the unhealthy fast foods I was consuming were not fueling my body with energy or making me feel good. My skin would break out from time to time, I felt depleted of energy, and I was always bloated or feeling heavy. So I decided to make a change in my eating habits. I did not see a doctor or specialist to tell me the changes I needed to make to have more energy, to feel lighter, or to clear my skin. Instead, I took it upon myself to change my eating habits. I was more conscious of the things I was eating and the frequency of what I ate. I noticed I was buying food at school most days that was cheap and unhealthy because I either didn't have the time to make lunch or didn't want to spend the extra money on healthy food. I often felt I didn't have energy. I was left feeling unmotivated, tired, and sad. I also realized I was wasting more money buying food every day than I would preparing food at home. It took time, dedication, and frustration to stick with my plan and to actually feel better. I felt like I wasn't able to find the time to prepare weekly meals and that buying fast food was more convenient. However, within a week of deciding to change my eating habits, I felt a small change in my physical and mental health. I started feeling lighter when I exercised, more energy and motivation to get things done, positive thoughts and focus in school, and my skin slowly started to have less breakouts. Although I did not cut out fast food completely, I did limit myself to having it once a week at maximum. I knew how to make the change. I needed to start preparing meals at home. Thankfully, I do live at home, so I asked my parents for their support. An intervention I chose was preparing my own meals. I started grocery shopping on Sundays with my mom, planning out my meals for the week. We would either make a meal the night before or I would take leftovers from dinner the night before. I found 10 tips from myplate.gov to help me prepare my meals and make better food choices. We made half of the plate veggies, had a good amount of protein since I am an athlete, and chose a healthy carb such as brown rice, quinoa, or whole wheat pasta. I had a lot of success with this intervention thanks to the help and support from my mom. If I were to eat a meal out or even at a fast food restaurant, an intervention I have used to help me is to make better choices. I found tips from Young Men's Health that helped me know healthier options to choose when eating at a fast food restaurant. This includes choosing broiled, grilled, or steamed food instead of fried, ordering smaller portions instead of larger sizes, getting a salad or fruit instead of fries, and toppings usually add more sodium or unhealthy fats, so adding veggies or using less dressing and condiments can lighten up the meal without taking away all the flavor. The challenges of this intervention were trying to be conscious of what I was consuming at restaurants and making better choices. I applied self-efficacy from the health belief model by reinforcing that I can find the time to prepare my lunches. I also applied outcome expectations from the social cognitive theory because I expected if I were to cut out unhealthy foods, I would automatically start feeling healthier and better. The last theory applied was attitude toward the behavior from the theory of reasoned action by liking the feeling that eating healthier and lighter made me feel. After the changes in conscious eating habits and planning my own meals, I was able to have the energy and mentality needed to motivate and get me through the day. I am no longer having breakouts, my skin looks healthier, and my body generally feels lighter. I recommend taking 20 minutes out of the day to prepare a healthy meal at home. Not only will it save you a lot of money, it will also benefit your body in ways you may not have even known were being affected. Here are my references, and thank you for listening.